Hey everybody, it's Eric with Motion Guidance, and thank you for joining me today. The topic for today is how to utilize the motion guidance device at the knee to pick up on deficits in quadriceps function. And this is mostly relevant for post-operative conditions like total knee arthroplasty, general arthroscopy, ACL reconstruction, meniscus conditions, or just contusion with some acute swelling or effusion around the area. This was brought up online with some questions with some of our viewers after we did some of the cheaters videos for the head neck area recently, and how to pick up on things that you can't necessarily see with the naked eye in clinic to help our clinicians diagnose and treat better, but also to help your patients recognize what their deficit is so they can maximize their performance not only in clinic but then utilize the home exercise program packs that we have with motion guidance so they can continue on at home in between sessions. So for this application, you'll need the knee strap that comes with the clinician kit. Remember, all of our straps have the hygienic backing on them, which makes them stick and not migrate on clothing, but you can put them directly on the skin and then wipe them off afterwards. A nice hygienic option there. In the clinician kit itself, this would be the second largest strap in that pack. We also have the home exercise program pack with the knee strap that comes with one individual strap and then the other components. We also want to use the flat mount today, not the perpendicular one, but the flat mount. You can kind of see that there. And then the rechargeable green laser comes into the patient pack automatically. So you can see how that shines out there with the green. All right, very easy to see. So we're going to place this at the knee and we're going to go over a few different options. But first I want to talk about the common deficits that we see just with quad setting and terminal knee extension. So one of the main focuses for things like total knee arthroplasty is getting that terminal extension, but getting it with the quadricep actively to make sure that we gain it. A common thing that we see in clinic is patients can contract their quad, but they're not actually gaining terminal knee extension. And then when they're in pain and they're resting at home and maybe not as diligent with their home program, or they're just not understanding what they're supposed to be doing, they end up getting that flexion contracture and losing extension, which of course affects gait, can produce anterior knee pain, posterior or lateral knee pain, and alter back mechanics, hip mechanics, things like that. So it could move all the way up the chain. So we want to make sure that we get that terminal knee extension as soon as possible after surgery, but also to keep it, right? That's going to be part of the goal early on in our phase 1 type of rehab. The other things that we can see as far as cheating or dysfunction is the patient will get a cocontraction. So they'll tighten up the quadriceps and the hamstring at the same time, and they'll tighten up in through their quad, and you can see that kneecap kind of tighten up, but they actually aren't dropping down into extension. So that's a common cheater that they'll have in gaining their extension. You'll also get dysfunctional firing of the quadriceps, and they'll actually substitute with their hip. So they'll start pushing down through the hip, and the quadriceps is actually fairly ineffective or inefficient in that position. And you can easily see that by just moving their kneecap side to side. And when they say they're contracting, if I throw my leg up here real quick, hey, I'm tightening up and I'm pushing down, but actually they're just doing it from the hip, and you can just move that kneecap all over the place. I call it the patellar wiggle sign in my clinic, okay? So they have a positive patellar wiggle sign, they can move that around, and it's just showing that they are inefficient with their quadriceps. So that's something that I like to utilize. Also, getting an extensor lag, so as they start to lift their leg during a short arc quad, long arc quad, straight leg raise, some open chain options, they will have a drop of their foot as they start to lift their leg, and that's called quadriceps extension lag. And they're not maintaining that full terminal knee extension throughout their exercise. One reason I still like to incorporate open chain kinetic exercise with this population, as well as some closed chain options, is that closed chain, you don't have to get that terminal knee extension pushing all the way back in stance while they're functioning. So it can be good through squatting type activities, step up type activities to get that closed chain function of their knee, but they're not gaining that terminal knee extension oftentimes in those exercises either. So let's apply the motion guidance device to the knee, and let's see how these will present while you're in clinic. All right, I'm going to slide my shoe off for this, similar to what you'll have in the patients post-operatively, and there's some markers on the sock that I'm going to utilize for this particular tutorial. So to put this on, okay, if I get up here, I'm going to get to the top of the kneecap, and I'm going to have a 3-finger width or maybe a 4-finger width above that I want to put the strap. Now this is just to help me standardize for everybody where I'm going to put it. All right, this doesn't have to be a particular distance, but we do want it on the thigh, not right across the kneecap. And I'm going to just adjust this to where the blue field is pretty much on top of the thigh here and above the kneecap. I'm going to take that flat mount and I'm going to slide it into the blue field. I'm going to tip that laser to the side and project that down toward the toe. Now let's go over these one by one, why this is important, okay? Utilizing the motion guidance device early on to establish quadriceps function. So if I project the laser down toward the toe, and you guys can see that there, if I do a co-contraction, well, let me back up a second. Let's take a look at normal, okay? And then we'll take a look at the dysfunctional things. If I tighten up my quadricep and it drives me into terminal knee extension, I'm going to see the laser move down on my foot because the heel should be rising up. That's going to be typical extension. So the shank starts to rise up as the quadriceps pushes down. The terminal knee extension or the screw home mechanism is locked in by the femoral condyles onto the tibia. And you'll see that action as normal quadriceps function. Okay. This is in contrast to what we still do, and if I might take a little bit of liberty here, for I don't know what reason, we still are pushing down on total knees initially as they come out of surgery in the subacute phase and the acute phase. It's not the same mechanism just to push down on both sides of the knee. It oftentimes is just painful and reinforces the lack of gaining extension for the patient, and it doesn't promote quadriceps function, which is actually going to gain terminal knee extension. Okay? So let's not do that anymore. It's definitely not built around scar tissue. It's built around contraction and fear. So let's just stop doing that and show people how to fire their quad and then work on other forms of terminal knee extension, maybe manually or with them at home. Okay? So if I go through back on track here, a co-contraction. So if this is normal and I tighten up my quad and the laser moves down on my foot, a co-contraction would do this. So I've contracted my quad and I've co-contracted my hamstring or part of my the posterior aspect of my leg, and the laser's not going to move. Okay? Oftentimes these patients, as the laser doesn't move and you start to show them quadriceps function, then they becomes quadriceps inefficient because in order to put their leg down, they don't tighten up their quad then. So they were co-contracting and now they don't understand how to just tighten up their quad and relax their hamstring. Okay? So watch for that laser not to move in this case as they tighten up their quad. So the wiggle test is now negative. Okay, you can't move that thing around. You know they're getting a good quadriceps function, but they're not getting quadriceps function to gain terminal knee extension. Okay, that's important. The next one would be they just push down with their leg in their posterior element. They have a positive wiggle test, so their quad's inefficient and they're just pushing down from their hip. That laser's also not going to move. It's not going to move because the shank is not going to be able to rise up into terminal knee extension as you get the screw home mechanism. So they push down and they're pushing down real hard with that posterior element and they're just driving that hip into the leg, into the table. They're driving that heel into the table. Their kneecap's swimming around there, but the laser's not dropping down. Okay? So that's going to also tell you what's going on there based on just a few easy objective diagnostics. All right. Now the next one that I mentioned is going to be that extension lag, quadriceps extension lag. So if they can start to tighten their quad and that laser moves down, I can give them some encouragement. Hey, can you move it down to the very last line on your sock? Really tighten up, squeeze, squeeze, squeeze. There you go. You finally got it. tighten, keep going, keep going, keep going, and you can do that with their shoelaces, you can do that just on their foot, you can draw a line on there, okay, and work that exercise over and over to really gain terminal knee extension with their quad actually firing and moving the laser. Now, when they start to progress to like a straight leg raise, okay, and commonly we'll put them in full supine or we'll put them onto the table in this sort of position, in a half hook lying position, they're going to tighten their quad and then they're going to lift their leg and they're going to lose full terminal extension, and that laser is going to end up being on the wall. And you can see that in the video. Okay? So they go to tighten up and push down, now the laser's on the sock, and they go to lift up and they lose it. So many of my patients can't feel that difference because their goal is what? Just to lift the leg, right? So they lost the initial quadriceps contraction and it popped onto the wall. So I need them to focus on whatever it takes to keep that laser on their foot, really give good effort, and hold that on the foot all the way up and all the way down. I'll see this a lot also. They finally get good at holding it, and then when it comes back down, they lose it, right? But that's going to be a visual reinforcement of their quadriceps inefficiency and lack of maintaining terminal knee extension, and that's what they can feel and see at the same time, and that's the positive for not only in clinic, but for home. Because they'll gain a memory of what it should be like, the effort that it takes to maintain that when you have an inefficient quad, maybe some effusion, definitely pain. Any of those things can cause inefficiency, all right? So you push down, you go to lift up, oh, and that laser leaves. And they're going to be trying to maintain that on the foot. Now, as a clinician, you can also give them goals. Maybe I'm going to put this further down my foot to make sure that they're getting successful reps of maintaining it on the foot. And then the better they get, I actually put it off the foot to start, push down onto the foot with contraction, and maintain that on the foot to lift. So you can create your own standard deviation with this particular activity with your patient, okay? And that's going to be great for them for feedback, all right? Now you can also do this with short arc quad. Now I'm going to come out of the frame here for a second and gain a ball that we commonly use for short arc quad here at my clinic. And I'm going to do the same exact thing. I'm going to put this on the wall, and I'm going to have them kick up trying to chase the laser with their foot. So that's true terminal extension. And what do we see a lot of? We see a lot of, hey, I'm extending, but I'm short. I can't quite get to the laser. Or I kick up this much, and then I try to lift off the ball because they're, once again, not gaining that terminal knee extension. We need to get them to chase that laser, keep getting terminal knee extension, and then maximize the length or the distance of the laser onto the foot. Pull that toe back at the end to pull on that calf and help drive that knee into extension and hold. Can I get that laser onto my pair of jeans here? Oh, yeah, if I get that terminal knee extension, I can. Okay? And that's the external focus of attention. Not on the knee, of the laser moving onto the leg. Okay? So the focus is down there, not here. We're likely going to gain some performance and some memory of how to do that with repetitions. And then as a clinician, you can decide, do I want to do numerous repetitions of this? Do I want to do 3 groups of 10? Do I want to just do a few? Do I want to spend several minutes here? Because it's that critical early on. All right? So those are several applications for the motion guidance device at the knee, likely for postoperative conditions. And I really want you to investigate this in your clinic if you have a device. If you don't have a device, obviously go get one. This is going to really eliminate a lot of the early deficits that you see with postoperative conditions. This is going to really help train completely your patient so that they don't have that extension problem and gain that quad function early on, and then it's all uphill from there as far as progress goes. All right? Downhill for difficulty. If you have any comments, leave them at the bottom. We'd love to engage with you. Otherwise, have a fantastic day. I'm Eric with Motion Guidance.